Today, the webinar, we will talk about the comparative study that the doctor has been doing in the last year, okay, to evaluate the comparison between the marginal bone changes in these implants versus Straumann, Astra, and Nobel, okay. During this presentation, it's trying to work in, okay, we will have description of the key environments for an implant, the points to consider when choosing a dental implant, the comparative study, okay, study these implants versus Straumann, Astra, and Nobel, okay. The summary of the study phase 1, this study is posted in our blog in the website, if you have to have a look, and the results of the study phase 2 in the last year. Finally, the doctor will conclude with some of the final conclusions.
Thank you so much, David. I'm gonna share my screen right now.
Yeah, please.
So good afternoon, everyone. I am Dr. Mohamed Khalifa. I'm a periodontist and implantologist based in Riyadh, Saudi Arabia. And it's my pleasure as well to be a key opinion leader with this company. Today, I'm gonna take you through the journey of the osseointegration and how we can select our implant. And finally, we're gonna show you our research project about the dental implant, and we are comparing it with different companies. So to understand where we are today, we have to give the credit to Professor Pranamark, who is the godfather of the implantology. Since he started to place the implants, we can say now there is millions of implants has been placed with long-term success. That's why we have usually to give him the credit. What about the osseointegration? To understand actually the osseointegration, as most of you know this definition, we have to know what is the definition. Osseointegration in a simple way, it's from two words, os, which is mean bone, where integration, it's mean a combination. So it's by definition, it's a direct structural and functional connection between the living bone and the dental implants. But before to understand what's going on and to understand how you can select our implants, we must have a little bit information about the osseointegration. Actually, we can consider osseointegration, it's a healing, like any type of healing in our body. And if there's any problem with this healing, finally it leads to a lot of problems in the osseointegration. That's why we have to understand what are the steps of wound healing. For any type of healing like an osseointegration, it has 4 steps. It's number 1, hemostasis, which is actually occur during the drilling of the implant and placement. Phase number 2, it's an inflammation, which occur within 4 days, where the immune cells can kill the bacteria and they remove the necrotic tissues. Phase number 3, which is proliferation, which is occur within 2 weeks and starts the cell to proliferate. And finally, phase number 4, which is a remodeling, which is occur from 24 days until a year, and it continues long life. So any disturbance during this phase, even you choose when any type of implant, if there any disturbance during these phases, it actually we're gonna face a problem. So now we have to know what are the factors that can affect the outcome of the osseointegration. Actually, it's not a single factor. It's a lot of factors that can provide an success of dental implants. First of all, we can gonna talk about the host. Why it's host? It's very important to know. As I mentioned before, if you choose to put the best dental implant in the world, and the patient is have any systemic problem, for example, let's take patient, he has diabetic. So, and as we know, if the patient has a high blood sugar or he's an uncontrolled diabetic patient, it will affect the final outcome. That's why when we're gonna choose, we're gonna make a dental implant, first of all, we have to check the state of the host. Is there any problem like diabetes, osteoporosis, and so on. What other factors that can affect the osseointegration? Actually, it is the status of the bone. If there is any problem in the bone, if there is any misdiagnosis, if you're gonna place an implant in a very thin bone and you don't, you will not go make any augmentation, actually it will be a big problem. Surgical technique as well. And actually, regarding the surgical techniques, and I know most of very skilled dentists. Sometimes when you do a lot of implants, there's going to be a little bit of errors during the placement. That's why nowadays we are going to of the digital dentistry. So I'm advising, if I'm going to do any full arch cases, you have to think a lot about digital dentistry. Why guided surgery is very important, because and when we think of the implant, it's not just an implant in the bone. Actually, it is the prosthetic where going to be our final prosthesis should be. So when you are planning from the beginning, you place your prosthetic part first, and then you're gonna place your implants. So you're gonna actually find the optimum results. That's why you have to digitally. And by the way, this dental implant, as you know, is totally matching with Straumann in the size of the implant and the kits and so on. So I'm usually using Straumann guided kit for placement of dental implant, this dental implant. So, as I mentioned, the state of the host, and all of you, I know you have a lot of, the guidelines. Who is indicated for the dental implant, who is contraindicated for the dental implant. For sure, we have to know who is. We have to should have a proper selection for our cases. Bone quality, as I mentioned. For example, when we are dealing with the D4 bone, which is probably present in the upper maxilla area. Nowadays, we are, this is a poor quality area of bone, so we are aiming to condense this bone by not just to remove the bone by drilling. No, we are using densabers, for example, to condense the bone and to enhance the bone quality and the stability. What are factors very important in our dental implants? Soft tissue assessment. And I know some of you are periodontists. We usually give very care for the soft tissue. And as we know, regarding the soft tissue classification, we have people with a thin phenotype, and we have people with a thick phenotype. And we know the people with a thin phenotype are more prone to gingival recession, bone loss. So in such these cases, we usually plan to take a connective tissue graft from the palate to enhance the soft tissue quality. Actually, it was my research, which has been published in the Journal of Oral and Maxillofacial Implantology. I was assessing the soft tissue by using CBCT, and it's very easy method. In a very simple way, you can put cotton rolls in the patient during scan, so you can see the shadow of soft tissue, and you can easily assess your soft tissue before planning. Actually, we found that during our research, and most of people who has thin gingiva usually are liable for dehiscence and fenestrations, and that's why we have to make concern for such cases. So we talk about the state of the host, the bone quality, and we talked about the soft tissue. Now we are talking about the implant. What are the implant, how we can choose the implant. Actually, regarding the implant, we have to start from the beginning, or to know. Long days ago, the implant at first was a machined implant. It was a pure titanium implant. And actually, it needs a lot of time to achieve an osseointegration. The old school by Branham market was almost we can wait for 4 months in the mandible and 6 months in the maxilla. Why? Because there is no some treatment for the implants that can provide more attraction of the cells. But by the research, we find that when you treat your surface, your implant surface, it will allow more attraction of the cells and will achieve what's called contact osteogenesis. What is contact osteogenesis? It means that the bone will start from the implant surface toward the bone, and this allow more faster healing rather than from the bone towards the implant, which is the old concept. So when you treat your surface implant, and you make it ready to attract the cells and the fibrin, and you achieve more faster osseointegrations. And a lot of companies made a lot of techniques for surface treatments. I'm gonna go through a little bit about this surface treatments. One of the most famous surface treatment in the market is sandblasting, SLA, sandblasting acid etching. It's provided by Straumann. And actually, it was found that by treated the dental implant, by blasting the surface of the implant, it creates a macro roughness. And then you put your implant inside an etching, you create a micro roughness. This macro and micro roughness, it will prepare your surface that allows the cells to be attracted, and it will lead to more. It will achieve what I said before, contact osteogenesis, which is mean faster bone healing. Other than SLA, there are several surface treatments like anodization by Nobel Biocare, and we have another technique, the laser lock by BioHorizons. We have titanium plasma spray by Straumann as well. We have fluoride application by Astra. All of these techniques or surface treatment, the aim is to prove the osseointegration. But the question is, what are the best surface treatments? So usually I'm going through the evidence base and the research. We can say, according to systematic reviews, that usually mentions that SLA surface treatment, it is one of the highly successful surface treatment with a highly most promising result till now. And as a company like this, we always reaching was searching for the best quality. That's why in this, we promote what's called OST surface treatment or osseointegration surface technology, OST technology. It's actually mimic or is similar to SLA surface treatment, and actually it gives optimum result. As I mentioned, an SLA is one of the best surface treatments in the market. So I go through some biology and what are the factors can affect the osseointegration. We have to know how I can choose my implant, otherwise it does, or any other of dental implant. So when you're gonna choose your implant, you have to make sure that the company or you are dealing with is provide and clinical research. You have to check the compatibility. For example, in this company, they are the pioneer of compatibles. They offer a lot of compatibles for different type of the dental implants. Easy of use. We need very easy surgical kits, easy use manipulation, implant handling, aesthetic focus. For sure, we are living in the era of the aesthetic focus. Balance for cost versus quality. We need something with good cost, but we need as well as quality. For sure, when you're gonna choose implant, you have to choose the implant that is available in every place. Whenever you can go in any country, you have to your implant should be present, and as well as warranty. And for sure, I mentioned before, we are in the era of the digital dentistry. You have to, when you're gonna select your implant, you have to make sure that your company is fulfill the all criteria that we needed for digital solutions. So what about this? I mentioned what are the criteria that we needed for selection of implant. Let's check this. As I mentioned, yes, has a lot of compatible, a lot of options for prosthetic parts. Easy of use. The kit is very easy, and as we mentioned, as a dental implant. Aesthetic focus. We have multiple options for the aesthetic focus, for the angulations. Cost. When you come to the cost, we can see the tests which mimic and the same surface treatment by Straumann with less cost. Warranty, and as we know, this dental implant give us an warranty, and the future regarding the future, our future dentistry, we can for sure we know the library of this is fulfills all criteria. That's why we can say that this it's meet the all criteria for selection of dental implants. So we're going to through to the last part of our webinar today, which is research. As I mentioned, we believe in science, we believe in research, and we usually looking for the evidence base. Since we have the dental implant launched their implants, we started to conduct a research project, and our aim to compare in this research project to compare the amount of the marginal bone loss by regarding through this dental implant and the other 3 premium implant in the market. We choose Straumann and Nobel Biocare and Astra Tech Biden Supply Sirona, and we assess the amount of crystal bone loss by using COM-beam CBCT directly during placement of the implant, and 3 months after. This was phase 1 research project. And actually, the result was very, very comparable when we found that actually in the amount of crystal bone loss, it amounts to 0.2 to 0.3 in almost in the 4 dental implants companies. And actually, when we're gonna compare this dental implant by the other 3 companies, it was very comparable results. That's why it was a very nice. But this is not enough for 3 months follow-up. That's why we plan to take it more further, more research. We made a follow-up after 6 months, and then we followed up after almost 1 year, and we checked even after assessed the bone quality, the amount of crystal bone loss, after prosthetic delivery. And here is our result. It almost so far little very near each other. Maybe to be honest, Straumann was the least the amount of the crystal bone loss, but when you gonna see the difference between the 4 types of the implant, you can find this implant. It's very near, it's very close to Straumann and Astra. So this difference, it clinically is not significant. So that's why we can mention that it's provide give us a very optimum result. So what we can say after a follow-up of 1 year of our dental implants, yes, all 4 implants was showed a progressive bone loss, but it's very minimal. And as I mentioned, it was statistically significant difference. No, there is no between the dental implant and other premium dental implants. Maybe Straumann showed the least crystal bone loss, but still the amount of bone loss is very minimal. And that's why we can now think about how to choose my implant, not only just about regarding the 4 type of implant. I can check the other items that I mentioned before, the cost, the warranty. That's why I can say proudly this dental implant are the same level than the premium other brands in the market. So finally, I want to thank you all. Thank you for listening. Thank you for today for my webinar. I am very proud to join Das Dental as almost 1.5 years, Das Dental company as a key opinion leader. Really, I want to thank David and Stella and all staff. They are very, very friendly staff. And thank you from my heart again. Thank you. See you soon again in different events, inshallah.
Thank you, Doctor. Thank you so much for your kind words. Thank you very much, Dr. Gain.
Thank you so much.
And see you soon.
Yes, for sure.